All right. So again, I'd like to welcome you. Today's webinar is brought to you for free thanks to the generous funding from the Department of Public Health. Again, my name is Gina Rodriguez, and today's webinar will be an overview of the Community Health Improvement Planning process, also known as the CHIP process for those of you that are looking to start or have already started. We will be with you today until 1:30, so we hope that you've got your lunch and are ready for some great information. Our presenters today are from Health Resources in Action as well. We have Rose Swenson and Amanda Ayers, and they will introduce themselves after we sort of go a little bit over about how this webinar is going to work today. So we will be asking you some questions, and we'll also be doing some polls this afternoon. So if you have any questions that come up along the webinar as you're going through the information, please feel free to type them into the question or chat box, which you will find on the right side of your screen. The webinars we will handle, and they will pop up on your screen, the polls that we will handle, and they will pop up on your screen as the webinar sort of goes along. And we also encourage you to use a hashtag. We will be tweeting throughout the webinar, and our hashtag is hashtag MA Coalitions, and feel free to follow us on Twitter, HRiA Institute, or at HRiA Institute. And this is sort of what the question box looks like. You'll sort of be getting a chat from one of our organizers, Kelly, who will let us know if you're able to hear us and making sure that your audio is working well. We encourage you to be interactive, ask questions along the way, and we hope you enjoyed today's information. And I'd like to introduce our presenters for today. Rose Swenson, who's a Managing Director for Strategic Planning and Organizational Effectiveness here at Health Resources in Action, and Amanda Ayers, who is the Senior Program Manager for Strategic Planning and Organizational Effectiveness. Whoa, that's a mouthful. Also here at Health Resources in Action. So I'm going to hand it over to them, and they're going to take it from here. Thank you, ladies.
Thank you. Thank you so much.
Rose, would you like to go first?
I will. Okay. So I'm going to introduce myself and give a little bit of background and then turn it over to my colleague Amanda, and then we'll get into the substance of the webinar proper. I am the Managing Director of Strategic Planning and Organizational Effectiveness, and over the past 5.5 years that our department at HRiA has been active, we've conducted several community health assessments and community health improvement plans across the nation, and we've been involved in every aspect of that, from either facilitating the planning process to offering technical assistance and guidance on plan implementation, to coaching leaders of coalitions and of working teams to really move the process forward. So we have a wealth of experience and a lot of things that we've learned through this sort of growing and learning opportunity in the world of CHAs and CHIPs, and we're happy to share that information with you. Amanda?
Yes, thank you, Rose. So my name is Amanda Ayers, and our department is affectionately referred to as SPOE because it is a lot to say, Strategic Planning and Organizational Effectiveness. I've been with HRiA just over 5 years, about 5.5 years now, but in the field of public health, actually in the state of Massachusetts for over 20 years. As Rose said, we have had a lot of experience all over the country doing community health improvement plans, and we're really excited to share some of that experience with you today. So we encourage you all to ask questions, type them in that chat box, and we will do our best to answer questions as they come up throughout this process. So we'll go ahead and get started.
So it is Rose again. A brief overview of the agenda that we would like to cover today, and again, please feel free to interact with us as you would like, to ask clarifying questions or anything of the sort. We'll tell you a little bit about what we hope to accomplish today, and we'll talk a little bit about the CHIP and actually the CHA and CHIP processes from the beginning of that process through to implementation, what some of those elements are, some of the things that you might want to consider, and what it means with the whole accreditation process. And we'll close the discussion with any questions, additional questions you might have, and a preview of future trainings that we will be offering, where we'll go into a lot of these topics more in depth. So this is intended to be a foundational introduction to the processes of community health assessments and community health improvement plans. We can advance. Today, we want to talk about the elements of those processes and what is required to complete each of those elements. And in particular, we want to spend a bit of time talking through tools and strategies for authentic community engagement. And really, when we think about these processes and we think about kind of the assessment, the planning, the implementation piece, we feel quite strongly and have had experience to kind of validate this opinion that the sooner you think about authentic engagement, the sooner you begin thinking about how you want to involve key stakeholders in the process from the very beginning of the process, the more successful you will be when it comes to implementing that plan, because you will have knowledgeable, committed individuals who have bought into the process and the results of that process and are ready to go and be champions in the field. So we will also be talking about how you make sure that your plan is actionable and that it is housed with data-driven elements, both in terms of evidence-based strategies, but also indicators that will help to gauge progress within the limits of the plan. Next slide, please. So the first question we want to ask, just to get a sense of who you all are, is have you completed a CHIP? And if you have completed a CHIP, where are you in implementing your CHIP? That either you haven't started it, you're just beginning to think about it, you're beginning the implementation, or you're well underway. So please take a moment to respond to the poll. Let us know how you're doing. Okay, so a number of you have completed a CHIP, which is good to know, and many of you, slightly more of you, have not completed a CHIP. So I think that we have information to share for both sides of the spectrum that will help when you're in the midst of the process or you're thinking about the process, but also as you've begun implementing the CHIP and are thinking about ways to make implementation most productive, most successful, and sustainable. So the next question, where are you in the implementation phase? Okay, so very few of you seem to be well underway in implementation. Several haven't started or just beginning to think about it, and about equal numbers of you are just beginning to think about it or beginning implementation. And again, I think that anything that we discuss during the webinar today hopefully will be helpful as you consider strategies and steps that you might take to make your implementation successful. So let's talk a little bit about why develop a CHIP. Since many of you are in the implementation phase, you know the benefits that a CHIP can provide. For those who have not begun this process, there are many reasons for developing a CHIP. It is a plan that helps to prioritize and address community health needs in direct response to an assessment of those community needs. And the CHIP is designed to be an overarching plan that is not duplicative and does not negate a lot of the plans and programming that is already underway, but seeks to leverage, coordinate, and align the strategies among all of those initiatives and between organizations and programs to really achieve a more substantive impact. In the process of developing a CHIP and in the process of engaging key stakeholders throughout assessment and planning, it's a way to really harness political will and community enthusiasm and to mobilize that will and enthusiasm, but also to get a handle on collective resources that might be brought to bear for implementation. And lastly, as a health department, a CHIP is one of 2 requirements. It's actually one of 3 requirements for accreditation. And so there's a very real need for health departments who seek to achieve that standard of excellence to develop a CHIP. Next slide, please. Accreditation is overseen by the National Public Health the Public Health Department Accreditation Board, and the goal is to improve and protect the health of the public by advancing the quality and performance of public health departments. And so, as many other institutions in many other sectors have done, we're thinking here about healthcare, we're thinking about schools, we think about police and fire agencies. It's a way of codifying the standards for good practice and recognizing those agencies and institutions that achieve and meet those standards. So it gives visibility to those agencies who goes through the process, and from a public health perspective, it starts to move away from the old story of you've seen one health department, you've seen one health department. It starts to create a more consistent view, consistent approach across public health departments and public health practice. Next slide, please. When you think about how the partnerships align among state health departments, local health departments, and hospitals, there are different sort of motivators or incentives to complete different elements of planning. Certainly for state health departments and local health departments who seek accreditation, the health assessment is a foundational piece, and it is required to be a collaborative process with multi-sector partners and authentic stakeholder engagement. In health improvement plans, again, that is mandated to be a collaborative process with a long-term effort towards moving the needle on population health indicators. And for health departments as well, developing a departmental strategic plan is the third piece for accreditation that basically looks at internal capacity and internal readiness to fulfill the essential public health functions and to adopt particular priorities or strategies outlined in the State Health Improvement Plan or the Community Health Improvement Plan. Hospitals and health departments often and necessarily combine in these efforts. Hospitals, nonprofit hospitals, often use the health assessment and aspects of the CHIP to fulfill their planning for community benefits called strategic implementation plans, and that data can be modified to fulfill that requirement mandated by the IRS for nonprofit hospitals. So there's a natural synergy here among the players to share their issues, share their interests, and to really achieve mutual benefit from kind of synergistic thinking and alignment of resources. Next slide, please. So if we think about all of the sectors who could be engaged in these efforts, and we think of how many of them they are, and how many different types of planning are going on, it only makes sense that these agencies would connect with each other and collaborate as much as possible on their plans. So the accreditation of a local health department can demonstrate a level of accountability and responsibility to many of the key stakeholders kind of listed in this table. It allows a codification or a recognition of the strengths and weaknesses of health departments in addressing particular needs that might be fulfilled through partnerships with any of these entities. And it's a way to leverage funding opportunities and come back and be able to demonstrate that that investment was useful and effective. Excuse me. I think we've talked a lot about this, the benefits of partner collaboration. Excuse me. The field is moving towards collaboration, and the Accountable Care Act has a focus on the intersection of public health and health care with a trend towards facilitating community linkages and community-based care networks. So we know that addressing the complex problems of moving the population health needle requires this type of collaborative effort. Next slide, please. Amanda, could you take this?
Yes, I can. So right now we have another audience question. So we want to know, in your current or most recent assessment and planning process, are you leading the process alone or are you collaborating with others? Keeping with the theme of how we're talking about the importance of collaboration, we're interested to know if you are collaborating with others. So for those of you who are collaborating, it looks like just under half of you are collaborating, or all of you are collaborating, which is excellent. So for those of you who are collaborating, we're curious to know, are you collaborating with hospitals, FQHC, which are federally qualified health centers, your local health department or state health department, if that pertains to what your project is, community-based organizations or coalitions, or other organizations. So we're interested in all of your collaborators. So if you are collaborating with more than one of these entities, please check all that apply. Excellent. Looks like all of you are collaborating with hospitals, health departments, and community-based organizations or coalitions, which is fantastic. FQHCs, we have at 67%, which makes sense because not everyone has an FQHC in their vicinity. And then other organizations, which can be anything from your local health department, fire department, Rotary clubs, government, legislators, lots of things to choose from that other category. So looks like you are all very well versed with the notion of collaboration, so that's fantastic. And we'll get more into that in a few minutes. So right now we want to just talk a little bit about what is a community health assessment, or as we affectionately refer to it as a CHA. So I am aware that we use a lot of acronyms in this field, so we're trying to spell those out, but if we use any that aren't spelled out and you have questions about that, please feel free to give us that question. So community health assessments are where we start with this process. They are designed to inform community decision making. So as you're moving towards deciding what you want your community to focus on in terms of priority areas, this assessment process informs people of why those decisions are made. It helps you prioritize health problems. So I'm sure many of you are aware when you go to a community group and you start talking about what are the issues in our community, there are lots of ideas, there are lots of thoughts, and a lot of times that pertains or comes from the area in which people work. So if you work, for example, in teen pregnancy, the area of teen pregnancy, from your vantage point, teen pregnancy is a very important health issue in your community. Likewise, if you work in the area of mental health or substance abuse, cancer care, etc. So, but the process of the health assessment helps prioritize all of those health problems. It also assists in the development and implementation of our community health improvement plan. So it definitely is a necessary step. It serves as a foundation, and it's a way to educate your community about all of the things that are health issues in your community. The community health assessment process usually involves a lot of different things. From collecting data, and we do use hardcore data. That could be anything from behavioral risk factor surveillance system data, youth risk behavior data, from your health departments. We also do secondary data where we do focus groups, key informant interviews, things of that nature. So we get both primary and secondary data to gather all of that information. That data is then analyzed and a report is developed. The findings are disseminated to your community so that everyone is well aware. And then a leadership team is formed to move that process. So the leadership, you'll see that this is from this matrix here, is meant to be circular in nature because it's an iterative process. We go through all of these things. That leadership team is important at the beginning to follow that process through, but also as you continue from the assessment phase to the implementation phase. The vision is in the middle, surrounded by engagement, communication, and collaboration. The vision is really important so that everyone has a general basic understanding in the beginning of your process of what you're trying to do. And creating that overall understanding is important so that everyone is on the same page as you go through the process and you get to the outcomes of the process, that everyone understands what your process is for, how it's going to happen, what your outcomes are going to be. So we move from that CHA, that community health assessment, into a CHIP, which is what we're primarily talking about today. So that is our community health improvement plan. So the community health improvement plan is a broad action-oriented strategic plan designed to improve the health of the community. So this is where we're really getting into identifying your goals, objectives, and strategies and making those measurable. Our recommendation is that communities or organizations choose between 3 and 5 priority areas to focus on. As I mentioned, when you start talking about what are the issues in your community, you may have anywhere from 5 issues all the way up to 40 issues. And those issues need to be prioritized so that the things that go into your plan are the things that you plan around, the things that you're trying to move the needle on in terms of improving community health outcomes during the time period of your CHIP. So one of the questions that often comes up is, isn't everything important? And the answer is absolutely yes, everything is important, but we all know that we can't work on all issues at the same time. So this is really just a prioritization of choosing what things are best to work on during this initial time period. And we'll talk about how we go through that prioritization process in a few minutes. So the CHIP is meant to be implemented over 3 to 5 years. We often get the question of why isn't it a longer time period? The answer is that because, as you all know, even in one given year, your environment can change, circumstances can change, funding streams can change. So it's definitely beneficial to make it a shorter term plan. The longer you get into your planning, 5 years and beyond, you look at having to amend your plan due to environmental circumstances. So that's the reason for the 3 to 5 year time frame. And typically, I would say the majority of plans that we've done in the past few years are 3-year plans. And then, of course, your CHIP contains opportunities for partnership leverage and a focus on enhancing impact. And the overall description of that is we often find that there are many organizations in a community that all have their own strategic plans. They're all designed to reach the outcomes that are targets for their particular organization. However, a lot of these larger priority areas that we end up planning around when we do a CHIP, we know that a lot of health circumstances are overlapping. It's not just mental health in and of itself. It has substance abuse often has an impact on mental health and vice versa. There are healthy eating, active living things in your community that impact the cardiac health of your residents. So knowing that all of these things are overlapping and that we can't look at any one particular health issue in a bubble on its own, that's the reason for doing this cross-collaboration, this partnership, and this leverage so that you can take the resources that are available, and we're thinking of resources broadly here, not just funding streams, but resources in terms of staff, space, all sorts of things, grant writing. So we're taking all of those resources and we're leveraging them across the different entities in your community so that you can reach that larger impact. This is our graphic for community health improvement planning, and I'm going to go through it. I know it looks like a lot right now, but we've broken community health improvement planning into 4 phases. So our first phase is planning. And we start with how are we going to do this? What do we need to put in place so that our plan is going to be successful? So we need a leadership structure. We need to make sure that we are very aware of who is going to be calling the meetings, who's going to be doing the communication, who's going to be doing that outreach. We want to outreach to our stakeholders. And in general, stakeholders are everyone. So it's really outreaching to whoever you can get to the table. When we're doing this broad planning, and we'll talk a little bit more about stakeholders in a minute, but it's just important to know that everyone who's in your community, whether they are in a health-specific field or not, is a stakeholder in the positive health outcomes of the community. We want to define our planning model, and we're going to talk about that in a minute. I'll give you some examples of planning models. The priority setting from the assessment data is a little bit about what I just talked about, looking at what came out of your health assessment and defining those priority areas that you are going to plan around, those 3 to 5 areas that we've talked about, and then developing our goals, objectives, indicators, and strategies for each of those areas that have been identified. So that's our planning phase. Our implementation phase is where we talk about action planning. And we're not going to get too much into action planning today. I will show you a brief template. But action planning is when you've done your CHIP, and after your CHIP's been written and you've posted your CHIP and you've talked to your community about the areas you've identified and what you'd like to do, then you have to actually move towards implementation. How are you going to actually get that done? And action planning is a step-by-step way of ensuring that you actually implement your CHIP. So we'll talk a little bit more about that, but that really has definitive steps to make sure that you are able to implement your CHIP and you're not looking at it as a whole document that seems a little bit unreasonable and not you're not able to actually break it down into categories to implement it. Developing an infrastructure, capacity building, a governance structure, and of course resources and finances are all part of that implementation phase. Another thing to remember when we're talking about implementation is that this is a community plan. So when we're talking about community planning, we need to remember that not any one entity is responsible for all of the resources, all of the finances, all of the steps in terms of implementation. So that's really important to emphasize the community part of your community health improvement plan. Phase 3 is our monitoring and evaluation phase, and there are different ways that you can do this. We've worked with different entities who've chosen to do this in different ways. Some use a dashboard to monitor the progress of their CHIP. Some do quarterly reporting. The important component of this phase is that you are communicating out to all of your stakeholders what's happening so that people are aware that there is movement in the community around your plan. There are things that are happening. Successes, we want to make sure that we highlight our successes and we talk about the things that are completed. And we also use that communication to talk about possible barriers that may come up that might be unforeseen and maybe creating a challenge to actually fulfilling one or more component of your CHIP. And all of that is fine. This is an iterative process, but it's important to make sure we're communicating back to our stakeholders about that. And then finally we have phase 4, which is to reevaluate, refine, and adjust. As you all know, and I just spoke about this a minute ago, is that we're all very well aware of environmental factors and forces of change that can happen in a period of time. So keeping in mind and knowing that that may happen, and that could be anything from the political will in your community to funding streams, many different things that could impact your plan that you've set forth. We want to just be aware that sometimes things change and we need to be flexible. So again, we're keeping in mind that communication is a very important part of making sure that this process is successful, and we are building that in to say when those things come up, we will accommodate and readjust to make sure that we are still moving forward and communicating with the community and our stakeholders. And then finally, quality improvement and sustainability planning. We want to make sure that when you set forth a plan that you have those supports in place to make sure that you can see this plan through till the end of the plan, and that involves sustainability. So again, this is a circle. You'll see those 2 arrows going through all 4 phases because there are so many components of each phase that are important to keep this process moving along, and that's part of your sustainability planning.
Amanda, might I make a quick comment here?
Absolutely, please do.
Thank you. So one thing I would like to share based on our experience with a number of different groups is that a lot of energy and resources can be put towards assessment, and we see that over and over again. There's a real interest in digging into the data and making sure that the assessment is rigorous and as inclusive as possible. Sometimes there is less attention paid to the planning piece, and sometimes there's equal attention paid to the planning piece, which is another kind of important element to kind of make sense of that data and get it into a usable form. Where we find really a lack of attention and resources come to play is in the implementation piece. And we can't stress this enough, that you should be thinking about implementation from the beginning of the process. Planning fatigue sets in, assessment fatigue sets in. This is, a multi-month process, but running out of steam or running out of resources at the critical phase of implementation can really, hobble you in terms of sustainability and in terms of really getting momentum that will carry you through the next time you pull through the process. So I just wanted to highlight that point. Thanks, Amanda.
Great, thank you so much. Okay, so we're going to dive a little bit deeper into some information in each of these phases now. So I want to start with phase 1, the leadership structure. And this is just an example of some of the groups that we've worked with. So here we have 3 levels of leadership, starting off with your advisory board. And the advisory board really serves in the role of overseeing the CHA and the CHIP process. So they help with the identification of priorities, they set forth the strategic guidance, and they're really the group that kind of oversees the whole process and serves as a major communication hub for making decisions when it comes to fulfilling each of these processes. Then we have a steering committee, and they are serving the role of overall management of the process, and they usually are members of the working groups. So they will be members of the working groups. Typically they serve as leads, but they can be just members of the working groups. But there's usually a steering committee member on each of those priority areas that you you designate for your CHIP process. And then we have our CHIP work groups. The work groups actually represent diverse sectors of your community, and they are formed around each priority area. So they are the ones that actually develop the goals, objectives, strategies, action steps, and outcome indicators and targets for each of the priority areas. This is really important for a lot of reasons. So I want to just talk a little bit more about the inclusion of diverse sectors of the community for these work groups. So in this broader holistic view of developing a CHIP, we want to remember that if you have a priority area around, for example, chronic disease, that you might not want to have, you don't want to have only doctors in that group, because there are a lot of different things that affect chronic disease. So when we say diverse sectors, we want to make sure that there, for example, might be someone part of that chronic disease group who works at your local, your YMCA and is involved in food and fitness programs there. You might want to make sure that you have somebody who's involved from the hospital and has, or a community coalition that might talk about different things going on in the community. So we want to make sure that each of these work groups are very diverse, despite the fact that their title has a specific priority area. Another component of phase one would be our outreach to key community stakeholders. And here, again, we want to understand and communicate the benefits of engaging community partners early in the process. And then this is one of the things that Rose alluded to. So when you're starting off, you want to engage those community stakeholders from the very beginning so that they can be involved in the process, invested in the process, and be excited about that and want to stay on when you get to the implementation phase. If you have a group where it's, you know, those higher up, either the advisory committee or just the steering committee making those decisions, and then you present your plan to the community and you ask them to implement something that they haven't been part of from the very beginning, it's much more difficult to actually get people on board to say, yes, I would like to be involved and give of my time and my resources to a plan that I wasn't part of from the beginning. They feel like their input hasn't been heard because it hasn't, and they haven't been engaged in the process from the beginning. So that's definitely a key thing that we want to emphasize as part of this process. The other thing is thinking about multiple ways to engage and collaborate throughout the planning and implementation process. So for many of you, going to meetings is part of your job. That's something that you do on an everyday or weekly basis. And so for you, engagement means attending meetings. We're all very well aware that, especially when we're thinking about this broad sector of people we would like to engage, that there are people who can't attend meetings for one reason or another. So we need to think about what other ways can we engage them to let them know that their input is valued, needed, and appreciated. Can we send them documents electronically and ask for their feedback? Can we ask them to participate in a focus group or maybe do a key informant interview so they can lend their ideas and thoughts to the process? Can we have them be a conduit to seeking out someone else in the community that we know they have a relationship with that we want to engage in the process? So there are lots of ways to engage people, and we want to make sure we're thinking broadly and keeping that context in mind so that we are able to engage people and they know that there's more than one way they can be part of the process. And this is our stakeholder wheel. So you'll see here we've outlined several sectors of the community for you to think about when you're going through this process. Traditionally, and I'm going back several years now because I think people are really thinking broadly now, but traditionally people would think of primarily your health department employees, maybe people from your community health center that you wanted to engage as part of this community health improvement process. Now we're thinking much more broadly. We are looking to involve business and industry as part of this process. We're looking to make sure that people who are responsible for transportation in our community, maybe even arts, our parks and recreation people are involved, our public safety people, people who use and work at our homeless shelters, our food banks, help with housing services, our librarians, another very important component to include as part of this process. So this just gives you a broad overview of those large stakeholder groups and then looking on the inside of the wheel to specifically some of the groups that you might consider reaching out to and including as part of your process. This is our stakeholder and community engagement matrix. So this is a tool that you can use to look at those broad engagement methods that I was just speaking about. So you have your people on the left-hand side, the role or sector that they represent in your community, and then how can we engage them? So maybe they aren't able to come to a meeting. They aren't able to be part of a regular member of a working group that meets once a month, but they are willing to complete a survey, or they are willing to host a focus group. Maybe they're willing to review documents and provide virtual feedback. So across the top, there are some ideas for how you can engage people. Please feel free to expand upon that. There are lots of different ways, and you might even have someone who offers up a different suggestion of how they can be engaged, but you still want to make sure that you're capturing their role in their sector and that person who's involved as part of the process. So this is a tool that you can use to do that. And so we have some examples that projects that we've worked with. So we worked with one city health department that was engaged in CHIP planning as a part of their accreditation requirements. So they were required to do this, but they were taking this process very seriously. And they worked very, very hard. They were able to engage stakeholders from pretty much every sector in their community. And our planning session was very big. I think we had probably about 70 participants at our planning session. And they came together and they were really excited to build on the power of collaboration, of having all of those people in one room. And because they did so much work on the front end to get those stakeholders together, and you all know from a planning perspective how difficult it is to get 5 people in a room for a meeting. So you can imagine coordinating and trying to get 70 people who are all hold different levels of different roles in your community, but you know, we had police chiefs, we had fire chiefs, we had a mayor, so we had some pretty high-level people as part of this group. So there was a lot of work that went on the pre-planning side to get all those people in one room for a good 4 or 5 hour planning session. But because they did all of that work up front, we had engaged and invested community partners. People were able to share what their work on a day-to-day basis was doing, how that was impacting other members of the community and the work that they were doing. We were able to generate collaborative prevention efforts and strategies throughout the city. And all of this served to provide increased positive community health outcomes. So we're very fortunate. This was a very good example. Specifically, we had a priority area around housing with this particular city health department. And one might think that housing might not be, traditionally someone might say that's not really a priority area for health, but in this particular community, housing is a big issue. And they had so many different people coming together to work on the issue of housing. And that really led to some very positive outcomes for housing in their community, and increasing housing, decreasing homelessness, and making housing healthier in terms of a lead paint and other specific housing initiatives that really serve to overall better the health outcomes of their community members. We are still in phase 1, and this is talking about defining planning models. And we will say here that in this instance, sometimes we use kind of a combination of these models, but these are 3 models that can serve as examples. So we have ACHI, which is the Association for Community Health Improvement model, and they have a toolkit on their website. We have the Catholic Health Association, and then we have the Mobilizing for Action Through Planning and Partnerships that are known as MAP. And all of these planning models provide a framework for community health improvement planning at the local level. They are evidence-based, they have specific steps for you to follow, so they're good models if you're in the pre-phases or you're thinking about this process. They're excellent examples and models for you to refer to when you're thinking about this process, and you can choose which one fits best for you, but we do recommend that you choose a model to follow that is based on, that's been proven, is evidence-based, and can show that it's proven to be successful. So here we are all the way at another audience question. So what we would like to know is, for those of you who have begun or completed a CHIP, what strategies have you used to engage community leaders and members effectively? Typing comments in the comment box. Yeah. So if you can type your comments into the comment box to answer this question, that would be great. So it looks like we don't have a lot of responses for this question. So Rose and I will just kind of tag team a couple different ways that you can use to engage community leaders and members. So we've already talked a little bit about some group discussions. A lot of times we are part of community forums where we will go host a community forum. There will be invite for, it's usually a large group discussion, and we'll talk to people about what they see as important health issues in their community. What's concerning to you? We've done this in probably 5 or 6 times in the past year in different communities all over the state and across the country, just to pull people together, and this involves everyone from parents to community leaders. It can involve legislators. It's really meant to be a broad, open forum for discussion, and that's really what it is. We give a time frame. It's usually an hour to an hour and a half for people to ask questions, to talk about their concerns, and we record that, and we use that as a foundation for pulling together key themes and common themes across the different ways that we use to engage people to start to pull together those important priority areas in a community. We talked about doing focus groups. We talked about key informant interviews, which we often do over the phone, so those aren't necessarily an in-person thing, and that definitely allows for more flexibility for people to be able to choose and say, you know, I'm available for this 45-minute time slot, and that allows for flexibility in them to be able to participate in the process where they might not be able to actually attend a meeting. Anything else you'd like to add there, Rose?
So I think in terms of community forums, you talked about kind of the front end piece of holding these forums to elicit priority issues or perceptions or concerns. You can also do a community forum on the back end once a CHIP is pretty well underway and drafted, to bring it back to the community to say, here's the data we've gathered, here's what you told us, here's how that resulted in a CHIP, what do you think about this? Is there anything we've missed? Is there anything that needs clarification from your perspective? So, so that you're kind of closing the loop on that piece. What we've also found is an effective strategy for subject matter experts who are in great demand and often very busy, is pairing them up with a process facilitator for working group discussions if they would like to engage in that aspect of planning or that aspect of implementation, so that they can participate from a content perspective and they can participate in from a community linkage perspective and not have to feel the burden of facilitating the group, taking notes, and completing some of those logistical pieces. So in looking at engagement of a variety of different stakeholders, what are the potential barriers to engagement and how can we mitigate those barriers so that we can get them on board? And I think part of the stakeholder engagement matrix is to say, there are lots of ways we can touch them. How do we touch these particular individuals? How do we make it easy for them to engage?
Excellent. Thank you so much. So we have a question here, and I'll read. In Hampton County, we kicked off our process with a Hampton County Health Improvement Forum, focusing on how poor health impacts local municipal budgets. Fantastic. That forum intrigued a lot of interest, especially since Hampton County has ranked last in Massachusetts according to County Health Rankings Report. That is excellent, and that is a great way to get your municipal leaders to realize how the decisions that they make can impact health and then reflectively impact their budgets and what they're trying to do on the municipal level, because oftentimes there is a disconnect there. So that's an excellent example. Thank you so much for that.
I want to comment on that question. That is terrific. One of the things that we found really useful at any stage of the process really is to get compelling leaders or champions from different sectors. So it might be a municipal leader, it might be a school district superintendent, it might be a clinical leader who's well recognized and well respected in the community to come out or participate on a panel or a community forum like the one you're describing and say, this is why this process is important to me individually and as a leader of this organization, and this is how I'm hoping to commit to this process in addressing our common needs and our common issues. That is a very powerful piece for engagement and mobilization.
Excellent. Thank you so much for sharing that. So I want to talk a little bit for a minute about prioritization of options. So as you all are aware, you have your community forum, you put it out there, you end up with all of these priority areas. Let's just say you have 40 different issues that have come up as a result of all of your processes, your community forum, your key informant interviews, your focus groups. You have all of these issues, health issues. How are you going to prioritize them and select what we recommend 3 to 5 priority areas for your CHIP process? So we use 2 different types of processes. One is a simple voting process where we give members of a planning session 5 dots, 3 to 5 dots, and we say you can vote on 3 to 5 priority areas. You can't vote on the same priority area more than once. So that is literally, we have all of the priority areas posted around the room, and we have people go vote, and then the 5 areas with the most dots are the 5 areas that we plan around. Sounds simple, but it is a visual process that really allows people to see visually. All of the people that are part of that planning session that are in the room were able to give their voice, they were able to vote, and in the end, even those people that have kind of dug their heels in and are passionate about their particular issues are able to say, okay, this is how things fell out. I'm still on, even if this is not my particular priority area that I work in on an everyday basis, I'm willing to get on board and be engaged as part of this process because I see how this one area affects everything else. So that's the simple way of prioritizing your different options. A more rigorous tool is a rating and ranking tool that we use, and we're going to show you that in a minute. You can also combine this with the multi-voting dots, but this actually asks the questions, 4 questions, which we feel are very important in terms of trying to narrow down your priority areas. The first question looks at relevance, so how important is this particular issue? Keeping in mind that we're asking that question in a broad context. So all of these issues are important, right? But when we ask you to think about how relevant something is, we're asking you to expand upon that. So how important is it in terms of the percentage of your population that it's affecting? How important is it in terms of the resources that you already have that are readily available to address that issue? That type of thing. Looking at appropriateness. Should we do it? So is the political climate right for us to address this issue right now? Do we have the support that we need, the resources that we need, etc.? Impact, what will we get out of addressing this issue? So if we're able to address this issue, how will that impact our community? and the overall health of our community. And then, of course, feasibility. Can we do it? So do we have enough things in place to really be able to show demonstrated positive impact in this area? So those are all things that really have people, and this can take a while if you're trying to do this for 20 different priority areas. It can take a while to kind of sit down and do this process, but it is a way to really think about these things in a broader context and more concretely. I'll show you an example of that rating and ranking chart here. So you list your health issues under step 1 on the left-hand side of the page. So there have been many times where we need more than 1 page per person because we have more than the 8 or so priority area slots that are listed here. So if you have more than that, you have to use more than 1 page per person. But this allows each person to take each issue. So let's say in slot A, we have teen pregnancy. You move from the left to the right across the page, and you answer all of these questions for teen pregnancy. You talk about how relevant it is it appropriate, what impact will we have, what's our feasibility, and there are different bullet points under each of those selection criteria to help you answer those questions. So you are actually rating each health issue based on those 4 selection criteria, and you're giving each health issue a 1 to a 4, 1 being a low priority, 4 being a high priority, and you end up with a total ranking for each health issue in step 3, the green column. So each health issue ends up with a total ranking. And then you take all of those health issues and a total rating, then you end up with taking each of those health issues and their rating, and you rank them in order of importance. If you have a tie, you have to break that tie yourself. So if you end up with 3 things that have a 16, you have to pick which one you're going to put first. But that allows you to very concretely see which health issues you have rated as the most important, and then people do the same thing based on how their health issues, they've rated and ranked their health issues, they put the dots up for their top 4, their top 5 health issues, and you're able to see, but this gives you a deeper dive into why those things were chosen as opposed to just sometimes opinion-based or the field that you work on. It makes you go through a deeper dive on why you have chosen to rate and rank each thing in that way.
Amanda, can I offer just a quick anecdotal comment about clickers?
Yes.
Okay. So I don't know if any of you out there have used clickers or electronic voting mechanisms in your CHIP prioritization process or even some of your community dialogues. They can be very, very helpful and very effective with a couple of caveats. One thing that I will say is that if you don't provide a tool like this in advance of actually going to the voting, and you don't allow the time for individual reflection in advance of the voting, it can frustrate people who can't see all of their votes at once and be able to kind of strategically apply their votes. So you'll have people who front load their votes, or you'll have people who save up all their votes and vote at the end. If they don't go through a conversation and an exercise like this where they've begun to think about these things before they actually vote with a clicker. And the voting with the clicker or voting with the dots kind of achieves the same thing, that you are making visible and very public and in real time the result of your conversation. But where we have seen this work the best, you go line by line through each of the priorities, you have people work out with a template, and then they either go to dots or they go to a clicker or electronic mechanism to do the actual voting.
Great, thank you, Rose. So when we are looking at actually developing our CHIP document, here are some of the components that are part of that document. So we always like to start off with our vision or values for your community. Those are usually developed as a group with a broad stakeholder of people, so that people are all on board with what is our vision here, what are we trying to do, what's important to us as a community. Then we have our goals and objectives and strategies for each of the priority issues or health topics that are chosen. So that's kind of the meat of your plan, is those goals, objectives, and strategies in the beginning of your plan. And then at the bottom we have action planning, which is a separate process. That's a separate planning process, but for communities that are really want to dig in and make sure that their CHIP, all the work that they've done to get to this point to develop their CHIP, that it actually comes to fruition, and that they have mechanisms in place to track that, to monitor that, to say for each action step who's going to be responsible, what resources do we need. It gets to a very detailed level, but for communities that want to do that, the action plan is definitely a next step in the process. Here's just an example of a vision that we wanted to provide you because it really is a good foundation for everybody to get on board and feel good about the process. So it's a description of the preferred future you're trying to create as a result of your work. So oftentimes when we're doing key informant interviews or focus groups, we'll say, what would you like to see? What was in your ideal, what would you like to see your community look like? What would make you feel good? So we have an example here. All residents of Somerset County have an equal opportunity to pursue healthy lifestyles and achieve social, emotional, physical, and spiritual well-being. So keeping that vision in mind, they wanted their CHIP to provide a clear plan to empower all who live, work, and play in Somerset County to do all of these different things. And we want them to have a broader understanding of health status of our population. We want them to be able to direct their own health and access community resources to support healthy choices. And we want them to engage as educated, knowledgeable participants in policy, advocacy, and decision-making activities that support the advancement of the community's health. So this is a pretty comprehensive example, but it lets you see how the vision really leads into what the CHIP is all about and what they want people to get out of the CHIP. So it's not just this document that we put together. There's meaning behind it. It shows where we want to go and what we want our residents to be able to achieve as a result of implementing this process. Our goals and objectives. So for every priority area, you're going to have a goal, which is your projected state of affairs that your person or system plans or tends to achieve. And this is meant to be very broad. So it's how your initiative is going to change things in order to solve the problem that you've identified and a result that you're trying to achieve. That's your goal. Your objectives get down to a much more measurable, concrete statement. So your objectives describe the steps that you're going to take place in order to achieve the behavior change that you've described in your goal. So your objective is, how are we going to get there? They state what you're going to do and how much you're going to do and by when. So this is where I'm sure many of you have heard the acronym of SMART. We want our objectives to be SMART. So we want them to be measurable. We want them to state how much they are going to increase, decrease, enhance, or improve the state of achieving this particular objective. And the objectives also break down your goal statements into manageable parts. So we typically have 2 to 4 action-oriented phrases for objectives for each goal to break down how you're going to achieve that stated goal. And then we have our outcome indicators and strategies that kind of round out the meat of CHIP plan. So our outcome indicators describe the baseline and target values for each objective. So if you think of our objectives that need to be measurable and you're predicting a stated percentage increase or decrease in change that you would like to achieve, it's helpful to know where you're starting. So we like to say our baseline, where we're starting, is X, and where we would like to get is Y, so that you can see the movement that's needed to achieve that objective. The other important reason for doing outcome indicators is not only do they allow you to track progress of your objectives, but they emphasize the need for data. So a lot of times people will choose something that they would like to see movement on, but there's not data, or there's not data that's available to be able to show that you have a baseline and you're able to predict your percentage of increase or decrease or your percentage of change that you would like to see, because you don't have that initial data. One thing I'd like to point out is that without that data, it doesn't mean that you can't focus on that particular objective, but without the data, we call that a developmental objective. So it means that you need to put some things in place before you can start tracking that particular objective. And that's fine. The only thing that we like to advise is that you don't want a community health improvement plan that is full of developmental objectives. It's okay to have a few in your plan, but you want the majority of your plan to be based on readily available data that you can track and that you can use to track the progress of how you're moving and how your strategies are being implemented. And then finally we have the strategy, which is an approach to how are you going to get things done. This is how are you going to actually achieve the objectives that you've just stated forth. So strategies identify the direction of specific action steps that you're going to need to carry out what you would like to do, the how. So strategies usually begin with words such as identify, we're going to advocate for, support, develop, train, educate, etc. They're action verbs that start off with your strategies. This is the how are we going to get to completing those objectives that we've set forth. The best strategies are those that have an impact in multiple areas. So again, we're looking for the biggest bang for your buck. So where can you really see an effect of what you're doing across more than one sector of your community? It's going to impact more than one population, etc. We really want to try to set forth strategies that are going to have the broadest impact possible. Rose, is there anything you'd like to add here?
No, it just some guidelines for all of you to consider. So similar to what Amanda said at the outset about priorities, that you're really looking for 3 to 5 priorities, which means 3 to 5 goals. More than that is really unmanageable. And what we're seeing more and more in communities is sort of the downward pressure to moving away from even 5 and 4 to really focusing on 3 priorities that can be tackled collaboratively and comprehensively and done well. Similarly, when you're looking at objectives, you don't want to have a whole long list of objectives. And we are often asked, well, how many is the right number of objectives? Generally speaking, you're looking at something in the neighborhood of 2 to 6 objectives per goal. If you start to inch up towards 10 objectives, either the objectives are not precise and specific enough, and you've got some redundancy, or you've got too much in there that you need to kind of unpack. So just as a general rule of thumb, you want to make sure that you're always kind of clarifying and refining so that you don't create this mammoth document that becomes unwieldy and that, you know, even the stakeholders who help create the document don't fully understand.
Great, thank you, Rose. Okay, so I think you're picking up here, Rose, with the develop and disseminating the final chip.
Yes, happy to. Thank you. So this is sort of the beginning of the implementation when you have gone through a process of drafting your plan and you're about ready to share this plan back with the planning group, the larger stakeholder group, and then, you know, potentially, and we recommend highly, back with the community. A couple of things that we do recommend as part of this process is that always there's a drafting phase, there's a review and editing phase, and there could be several phases of that before you come up with the final document. And it's really important to identify and engage content experts and epidemiologists in each of the priority areas to take a look at the strategies to make sure that we have an appropriate evidence base, and also to identify and or validate some of the indicators and targets that stakeholder groups have selected for the plan. In some cases, where we're doing a very broad kind of stakeholder engagement process for developing the CHIP, Those indicators can be all over the place. In some cases, there may be no indicators at all just because there isn't a solid kind of expertise in the room to develop them. So having the bank of experts who could really help with that piece is really important. Once the chip is developed and finalized, we do recommend sort of wide dissemination, both in terms of print versions, having it available online on a website, but also taking it back out to community forums to say, you know, this is what we heard, this is how we responded, this is how we're going to approach this, what do you think, how would you like to stay involved, how would you like to stay informed? So using that wrap-up piece as an important opportunity for further stakeholder engagement. Can we advance, please? So we're going to ask you another question here. We've talked a lot to you about the various stages and elements, and we'd like to hear from you what your primary concern or challenge is regarding chip development, and select any or all of these that apply. Commitment and accountability of partners, clarity around who's making decisions at any level, managing the financial resources to sustain the effort, defining leadership roles, and that goes back to kind of the accountability for those roles, the infrastructure to support this, and that could include technology, communications, marketing, processing of invoices, et cetera, and any of those types of things. Please take a moment and select all that apply from your perspective. Okay, from what I'm seeing, we've got clarity around decision making, managing financial resources, and infrastructure taking the lead as primary concerns. And I can't on my screen see the votes. Oh, there we are. 0 on commitment and accountability and 0 on leadership roles. So the focus is really on how do we ensure that our processes around how decisions get made both in the short term and the long term are clear, and how do we communicate that in a very transparent way. The second is how do we manage financial resources to sustain this effort, and I would guess what is the commitment and or responsibility of partners to contribute some of those resources. And the third, and we totally agree, is the infrastructure element, because this is critical for implementation. So the infrastructure piece is something that can be provided by an institution or multiple institutions, but without having those critical elements kind of defined and in place, it's very hard to keep awareness and momentum going for the chip. So thank you all for those responses. And we want to share an example of a coalition that has done extraordinarily well on each of these components and how they made that successful. So before I share the example, once you get into drafting and disseminating your chip, you're now poised or simultaneously poised to start the action planning process. And we've worked with groups who want to do multi-year action plans, and we strongly recommend that you consider doing annual action plans for all of the reasons that Amanda shared earlier in the webinar. things change very, very quickly. And if you're planning a multi-year action plan, we could pretty much guarantee that you're going to be throwing away year 2 and year 3 of that plan and redoing them anyway. Even with a year 1 action plan, the expectation is that you're going to be monitoring and adjusting that plan along the way to reflect current reality. So these are very dynamic documents and dynamic processes, and we really want to, emphasize that you want to make each element manageable, meaningful, and relevant to all of the constituencies. So one of the things that we look at, thank you, for developing the action plan is working through a template or a tool like the one that you see here on the screen that basically spells out in finer detail what is going to be done over the course of the year to fulfill a particular goal, objective, and set of strategies. The first and most critical point in action planning is to prioritize which objectives you want to tackle in year 1. And the expectation is that you will not tackle all of them. So from the perspective of, what should we peel off first, things to consider are, where do we already have significant on-the-ground momentum that we could add a little bit of rocket fuel to from the perspective of sort of this gathering coalition and really make a mark. Where can we see a quicker, easy success from that perspective? What do we need to do first? And where can we, demonstrate some outcomes? So those are potential things to consider for the year 1 objectives, and prioritizing those objectives is the first critical piece. The second is to really begin to identify the action steps on the lower part of the tool that are the tasks, if you will, that are required to really implement the how described by the strategy. So if the how of the strategy is to develop a comprehensive community outreach plan, there are lots and lots of tasks required to fulfill that strategy. And who's going to do that needs to be identified, what the kind of interim products or results from each of those activities need to be identified, and when over the course of the year that is expected to happen needs to be identified. In addition to how you're going to monitor and evaluate those activities and any resources that would be required to fulfill those activities. So again, this is taking kind of the strategic elements of the CHIP and boiling it down and identifying those tactical efforts that are required to actualize the CHIP for the first year. Can you advance, please? In terms of phase 3, and this is a critical component, so we talked about, there's the assessment phase, the planning phase, the action planning phase, which is part of implementation, and now we're talking about monitoring, evaluation, and communication. Doing this consistent checking and communication back to the community, back to the various leaders and stakeholders who are identified in that stakeholder matrix is critical for keeping enthusiasm alive for the CHIP, to show that progress is being made, to encourage additional partners and participants to come to the table, and to make any changes or corrections based on how things are developing. So this is a piece that is essential and really depends very much on having an infrastructure in place to either hold a website where the progress reports can be posted, to send out social media blasts or tweets to kind of alert people to different events, to have a website where community members can share stories about what they're doing or experiencing related to different priorities, etc. And part of this is kind of the whole marketing, outreach, communications piece to identify those stakeholder audiences and the messages that need to be communicated to each of them. Advance, please. So here's our example. So we worked over 4 years with a county in Texas on developing their initial community health assessment and their community health improvement plan, and then worked with them to facilitate this action planning piece for the next 3 years of implementation for their CHIP. They had 80 plus stakeholders at every one of those action planning sessions for each year. And that's pretty remarkable. Those 80 stakeholders were fairly consistent during implementation, during planning. They were very reliable, very committed. Why was that? They paid very critical attention to this ongoing continuous communication with the stakeholders. They had a website. They had quarterly reports. They had emails. They had other mechanisms. They had community forums. And they were constantly sharing about what was going on with the CHIP, what was going on with various partners, so that it was alive and visible in the community. They did quarterly monitoring of progress on the action steps for each of their 4 priorities, and they discussed them as a steering committee, so kind of that middle rung of kind of the leadership structure that Amanda showed with you earlier. Quarterly they got together, quarterly they looked at the reports, and quarterly they discussed some of the elements that made this work. And they paid attention to celebrating successes and having that be part of their community forums and their community engagement. So there's a lot of goodwill and a lot of momentum for this particular coalition, and I want to emphasize a critical point. 1, 2 of the groups in the coalition offered infrastructure support, and 2, that members of the coalition, when funding dried up for a couple of the priorities, collectively wrote grants to bring that funding to the coalition. And that's the power of having this type of engagement and this type of connectedness. Rather than individuals coming to the table, this is really a collective group working together. So next slide, please. Because I know that we're coming upon the end of our webinar, and I wanted to just share with you that this is what you can expect for a typical community health improvement planning timeline. In the first 1 to 6 months, you're looking at conducting your assessment. In the next 6 months, you're looking at developing your CHIP. After a year or just shy of a year, you're developing your year 1 action plan to implement the CHIP. And then from then on, you're doing the implementation, the monitoring, and the communication to make sure that you stay on track. And that's it for my piece of the presentation. Amanda, I don't know if you have additional comments before we turn it over to questions.
I don't. Thank you so much, everyone. I hope you found this informative and helpful. So we'd like to open it up now. If anyone has any questions, we're happy to answer those. Feel free to type those into the comment box.
All right, and we encourage you to continue typing if you are sort of typing something in the question box, and I'll just go over some of the great things that we have coming up. And so we hope that those of you that have joined us today are able to join us in our next training that's in this CHIP series. So we have a training coming up on March 9th, which will be an in-person training that will be talking about effectively implementing one of these CHIP series. And we're going to be having 2 of those coming up. And so we hope that you guys are able to join us. Again, the first one's on March 9th and the next one is on March 27th, and we're looking to hit up different communities. So please feel free to check our website as we have coming up. And then in May, we're going to be looking into doing addressing challenges and barriers to implementing a CHIP, because we know that these things come up throughout the process, and we want to be able to help you work through that. And so again, we have our 2 in-person trainings that are happening, and then we also have the challenge webinar that's coming up in May. And in addition, we have our health equity series, which we're also really excited about, the webinar that we just did earlier this month, and our in-person trainings that are coming up later on in March and April as well. So if you have any questions, please feel free to give us to shoot us an email, check out our website, or find us on Twitter, and we'd be happy to connect with you around our upcoming trainings. And please, once you close out this webinar, take our survey. We love feedback and love hearing about any trainings that you're interested in that maybe we don't have on our roster yet. Please feel free to, again, fill out that survey and shoot us any information. We hope you enjoyed today's webinar. We'd like to thank Amanda and Rose for giving us the information and taking us through this process. Again, we will hope to see you at our next CHIP series training, and please feel free to share the webinar as well. I think we had a question pop up, or maybe just a comment, so I think we're good to go. If you have any questions, please feel free to contact us, and we will see you next time.
Thank you.
Thank you so much.
Thank you all.